Leah. I'm your student nurse today.
Okay.
How are you?
I'm good. How are you?
Good. Can you tell me your name and date of birth?
It's Emma Myers, 8/19/03.
Thank you. So today I'm going to be doing a neuro exam, so we're just going to be testing some different things, and I'll be inspecting if that's okay.
Yes.
Okay. Do you have any history of concussions?
No.
Okay. Are you in any pain today?
No.
All right. General survey. Patient is alert. She's conversational. She's sitting up, and she is pleasant. So, can you tell me where you are right now?
The College of Nursing building.
Okay. And then what day of the week it is?
It's Thursday.
Okay. So patient is oriented to person, place, and time, and her Glasgow scale is a 15. Next, I'm just going to have you stand up, if you will, and then I'll just have you walk to this table and back. Okay, thank you. So patient's stable. She has an equal arm swing and her posture is straight. And then if you will put one leg up and hop on the other one. Okay. And then on the other leg. Okay. And then if you can stick one leg out and bend your knee. Right. Okay, thank you. So you can sit back down. So the patient was able to complete the movements. Next, we're going to test your patellar. Okay, so patient's patellar reflexes were at 2, and they were symmetrical. And then lift this up. Is it okay if I take your socks off?
Yes. Sorry.
You're fine. Okay. Patient's Babinski reflex was negative.
Didn't mean to scare
Oh wait,
you.
actually, let me just. Okay. Right. And if you want to lay all the way back. So we're just going to be testing your stimuli. So this is sharp and that's dull.
Okay.
So if you'll just close your eyes and tell me what you feel.
Dull. Sharp. Dull. 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 Sharp. 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 Dull. Dull. Sharp. 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 Dull. Dull.
Alright, so patient was able to correctly state sharp and dull in both upper and lower extremities. So you just want to sit up for me, and it was symmetrical bilaterally as well. Okay, do you have any recent change in smell?
No.
Okay, so cranial nerve number 1 is intact because of no change of smell. And then for cranial nerve 2, I would have you read a Snellen chart. You'd stand 20 feet away, cover one eye, the other eye, and then uncover both, and read to your lowest line with glasses or contacts if you wear them. And 20/20 is expected. If it's 20/30 or higher, I would refer you to a specialist. And then if you will just read this first line for me.
Caution, failure to follow instructions.
Okay, thank you. So patient's near vision was intact because she was able to read 14-inch font 14 inches away. So cranial nerve 2 is intact. Next we're going to do 3, 4, and 6. So I'm just going to check pupils. Okay, so they are 4 millimeters and they are equal and round. And next I'm just going to shine a light into each eye twice. Correct. Consensual. Right. all of this in. Okay. So her eyes were able to accommodate, and her pupils constricted when the light. Now, if you can just follow my pen light with just your eyes. So cranial nerve 3, 4, and 6 are intact. Patient's eyes were perla, and then move to cranial nerve 5. So I'm just gonna put my hands on your cheeks, and if you'll just clench your jaw for me. Okay, and then I'm just gonna have you close your eyes, and you can just tell me when you feel this.
No. 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 No.
Okay. So cranial nerve 5 is intact. This patient was able to clench jaw symmetrically, and was there any pain with that?
Mm-hmm.
Okay, no pain, and she was also able to feel the stimuli bilaterally. And then cranial nerve 7. If you can raise your eyebrows, close your eyes tightly, smile, frown, and puff out your cheeks. Okay, cranial nerve 7 is intact because the patient was able to make faces, and they were symmetrical, and there was no drooping or anything. So if you just want to turn face this way for me, and then if you'll cover one ear, and I'm going to whisper a word and you can repeat it back.
Pineapple.
Okay, good. And then
Raspberry.
yes, okay, good job. So cranial nerve 8 is intact because the patient was able to repeat back the words I stated. We're gonna go to 9 and 10. If you'll just say, open your mouth and say ah. Okay, thank you. So, patient's uvula went up and in towards midline. Her tonsillar pillars and soft palate did as well. So 9 and 10 is intact. Cranial nerve 11. Okay. So I'm gonna just put my hand on your face. You'll just push against it. Okay, and the other side. Okay, so patient's sternocleidomastoid muscle was strong and it was symmetrical, and then I'm just gonna hands on your shoulders, and if you'll raise up. Okay. And was there any pain in either of those? Okay, so no tenderness, and then the trapezius muscle was strong and symmetrical as well. So cranial nerve 11 is intact. And then for cranial nerve 12, can you stick your tongue out and then to either side? Okay. And then can you say light, tight, dynamite?
Light, tight, dynamite.
Okay. And patient was able to state the words without stuttering or having trouble, and her tongue was midline when she stuck it out. So it's intact. Can I get you anything else?
Nope.
Okay.